If a colonoscopy is on your 2025 to-do list, listen up. Here are my top 5 pieces of advice to help get you through one of the most dreaded but most worthwhile exams. I'm Dr. Karen Zagian. I'm a board-certified colorectal surgeon, and I've had 2 colonoscopies myself, and I do multiple ones for other people on a weekly basis. One of the most dreaded but most critical parts of a successful colonoscopy is that colonoscopy prep. And guess who is in charge of that? You are. You're in charge of your own successful colonoscopy by doing an excellent job of cleaning out your colon. So my top 3 tips have to do with cleaning out your colon properly so that we, your doctors, can see inside nicely. You want your colon pristine and clean so that we can do a good job of doing a thorough evaluation and ruling out any precancerous polyps. Remember, at the end of your colonoscopy prep, once you're done drinking everything and you've gone multiple times, we're looking to see what looks like urine coming out of your butt. There really shouldn't be any chunks or residue or any brown color to the effluent at the end of your colonoscopy prep. It should literally look clear. My number 1 tip is for anyone who tends to run a little bit more constipated than usual. If this is you, if you tend to not have a bowel movement every day, if you're like a once every 3 days goer, or if your bowel movements are hard or incomplete, this is for you. You want to talk to your doctor and let them know that you tend to not go as frequently and that you might be walking into the day of your colonoscopy prep a little backed up. And your doctor may recommend a few things to make sure that you have a successful colonoscopy prep if you do tend to be a little more constipated than the average Joe. The first is to make sure that you are really aggressively doing whatever laxative regimen or whatever gets you going more frequently the week leading up to your colonoscopy, so that if you need to take a little bit of extra Miralax or a little bit of extra magnesium, or you want to double up on any of your prescription medications in the week leading up to your colonoscopy to make sure that you're not walking into prep day backed up, this is going to be key and critical. Number 2, sometimes we'll recommend a 2-day colonoscopy prep. So instead of prepping for 1 day, you're prepping for 2 days. This is to make sure that you are completely clear. And sometimes we may actually recommend the bigger, large volume preps. The smaller preps, the ones that everybody wants, may not be ideal for you if you're constipated. So talk to your doctor so that they can properly advise you on which prep is going to be the right one for you. You don't want to have to repeat your colonoscopy again because we could not see enough or get through your whole colon. Now, we are frequently prescribing, and many patients are asking for the smaller volume proprietary preps, the pill preps, the small bottle preps, etc. Guys, this is tip number 2. In order for this prep to work properly, you really have to drink a lot of fluids. Those pills really need the fluids and the electrolytes that you're drinking in addition to the prep in order for them to work and to properly cleanse your colon. So don't just drink the little 2 bottles and assume that you're going to get a good prep. You need to drink additional fluids throughout the day to activate that prep. Number 3 is part of your clean out, but not exactly on the day before. This is a week before your clean out. You want to make sure that you're not eating a ton of quinoa and chia and nuts and things that are roughage that are going to stay behind inside your colon, that are going to clog our scopes and are going to make it difficult for us to see underneath. So you want to minimize any roughage the week leading up to your colonoscopy so that whatever is left in there, we can hopefully suck out. If you have chia and quinoa stuck underneath a layer of fluid, we're going to have a hard time seeing underneath that area, and we're going to have a harder time doing a thorough evaluation. Number 4, if you're scheduling your colonoscopy, and this is not always possible because I know some doctors just scope all day, but if you can get your colonoscopy scheduled in the first half of the day, that's just going to be ideal for you. Most likely you will not have to do a morning prep. You'll only have to do an evening prep, which is a lot easier to do than to drink a whole volume of solution early in the morning when you wake up and having to poop again before you head over to the endoscopy suite. If you can do all all of your prep the night before, and we generally do this for anyone who has an early morning colonoscopy. It's just going to be easier to finish all of your prep the day before, go to bed, and then wake up in the morning dry and come in to get your colonoscopy. I realize it's not always feasible. Some doctors have to schedule in the afternoon, but if you can get yours scheduled well in advance and get a morning time, that's going to be a lot easier to tolerate than having to prep in the morning. And 5, guys, please just read your colonoscopy instructions at least a week in advance. There's so many people that read their colonoscopy instructions the day before they're supposed to come in for a colonoscopy, and they've forgotten to stop taking medications that they're supposed to stop taking. They're taking supplements that they're not supposed to be taking, and that can totally mess up your ability to get a successful colonoscopy. So just read all of your instructions ahead. Make sure you have all your supplies, your prep is ordered and ready to go. Sometimes you might not be able to get to a pharmacy on a weekend to get your prep if you're getting that from the pharmacy. So you want to make sure all your ducks are in a row so that everything goes smoothly. Happy prepping, guys, and let me know if you have any questions.